Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome June Pomeroy. She's a registered nurse. Today's Kevin MD article is How Physician Obesity Affects Patient Care. June, welcome to the show.
Thank you so much for having me.
All right, let's start by briefly sharing your story, and then we'll jump right into your Kevin MD article.
Okay. I'm an RN and I've worked many years at the bedside in the hospital. And as I've gotten older, those 12-hour shifts can be very brutal. And I wanted to be able to do something else with my nursing degree where I could still teach and make a difference in people's health. So I've transitioned over to being a freelance health writer. And that's a great way for me to still use my knowledge and to help people.
All right, so you talk about how physician obesity affects patient care. So before talking about that article, what led you to write about this topic in the first place?
I was working on my continuing education requirements for my degree, and I'm from Michigan, and Michigan now requires implicit bias education. So when I was completing that implicit bias module, I was really struck by the numerous biases that there are. There are many, race, nationality, gender identity, ethnicity, religion, age, socioeconomic status, disability, and the one that really caught my attention was weight bias. Because have struggled with obesity my whole life, that's very personal for me. And obesity affects 1/3 of the adult population in the US. And of course, that includes physicians. And it costs an estimated $147 billion annually. So, Medscape Medical News recently published an article that examined the stigma and the bias experienced by obese physicians. And that was the article that really piqued my interest and I decided I really wanted to write something about this because, yeah, it's very important. There's a lot of obese physicians, just like the rest of the population.
All right, so tell us what your article is about for those who didn't get a chance to read it.
Okay. One thing that surprised me was how few studies there are about this. The studies that I found that actually looked at physician obesity and the effect that that had on the care they provided for their patients, most of those studies were 10 years old. The information in the studies is still very valid, but it just points out to the point that we are really not looking at this really important issue that needs to be examined. So another thing that was really pointed out in the research that I did was the multifactorial chronic nature of obesity. There's so many drivers for obesity: biological, genetic, environment, hormonal, mental health, and trauma factors. Those all play a big role in obesity and have to be addressed. And there's a lot of systemic barriers. There's very little access to healthy food options in food deserts, and socioeconomic limitations and cultural norms. Those things all play a big role. And the startling statistic for the genetic component was the fact that children have a 50% risk of obesity if they have one obese parent, but they have a 75% risk if both parents are obese. And we know the statistic of 1/3 of adults are now obese. So that really points out what can happen in generations to come. It's just going to continue on. So my article really focused on the professional stigma that obese physicians face. Their colleagues often view them as less credible if they are obese, and their colleagues will fail to really recognize the complexity of obesity. And there's also career impacts, negative impact on professional advancement and peer relationships. And there's this physician heal thyself expectation that because the physician has the knowledge, then they shouldn't have these issues that other people have. And that's a really heavy weight on the shoulders of physicians that do have a high BMI. And then there's the patient perception. Patients assume that their obese provider can't help them if the physician is struggling with the same issues. And one of the studies that I found in the Obesity magazine pointed out that patients had less confidence in their obese providers. They were less likely to follow the medical advice of that provider, and they were more likely to change providers if their provider was obese. So that was kind of a sad statistic. The clinical impact showed that normal BMI physicians,
Hmm.
as opposed to physicians with a higher BMI, the normal BMI physicians, they were more likely to discuss obesity with their patients and to provide counseling and to actually give them an obesity diagnosis. So there's definitely some missed opportunity there where obese physicians often wanted to, or they often waited to discuss weight loss with their patients until the patient's BMI was higher than the physician's own BMI. So that can result in delayed interventions and referrals due to the physician just not being comfortable giving that counsel when they're obese themselves. And then there's also the reduced treatment confidence. One of the physicians interviewed in the Medscape article stated that she felt like a fraud or she felt like a hypocrite when she was talking to her obese patients about health risks while she was obese herself. So a couple of the things that I sort of saw as lessons or ways that clinicians can actually make improvement is to have self-awareness without self-judgment. The physicians need to just honestly look at their lifestyle and make the changes that they recommend for their patients. Taking time for self-care will just pay huge dividends in physical, mental, and emotional health. And the result from that can be a more trusting relationship between doctor and patient when they see that the physician is taking their own advice. So a couple of the things that really need to potentially change is there needs to be evidence-based protocols. Physicians, providers need to stop focusing solely on BMI,
Hmm.
and they need to be trained to focus on things like muscle strength, metabolic flexibility, inflammation reduction, blood sugar stability. Those factors tell far more about long-term health than just weight. And that broader focus then can lead the way for the creation of evidence-based protocols for treating obesity. So another thing that I found very surprising, it was in another obesity study, that only 36% of physicians reported that they had very good or good obesity-related medical training in medical school or residency. So it's obvious that there needs to be better training before they ever become
Hmm.
physicians or while they're in their education process, because the obesity epidemic is definitely here in US.
Yeah.
So another thing is to not be afraid of an integrative approach. Because obesity is so complex, referral to an integrative or a functional health provider may be appropriate. Most physicians just aren't trained to have that integrative or functional approach. And they also don't have the time to actually dig deep to have the success. They're so focused on the comorbidities of diabetes,
Hmm.
hypertension, heart disease, and we know how packed full their schedules are. They're only given a short period of time to see each patient, and they just don't have the time to do the deep dive that sometimes needs to happen in order to really be successful. And that a referral might be appropriate for the patient, but also for the physician themselves.
Sure.
If
So
they're
let me
really,
let me jump in there. So a lot to unpack there. So in the beginning, you said that there's studies that show that physicians who are obese sometimes delay treatment for treating their patients' obesity and also can contribute to their own burnout because they have that physician heal thyself expectation, right? So
right.
during your years at a bedside, have you personally seen cases like this that kind of support some of the studies that you're seeing? Any personal experience or observations that you've seen?
Well, most of my time was in pediatrics, so
Hmm.
I did not do a lot of adult medicine. But, we definitely had obese children come in for various things, and there definitely could be that, just kind of that undertone of things need to change and giving the parents a sermon of what they needed to be doing for their children. And there definitely was that undertone there, yes.
And you quoted that physician from the Medscape article who felt like a fraud discussing obesity while being obese. What are
Right.
some ways that we can support physicians who are struggling with their weight so they can confidently provide care without that sense of hypocrisy?
I think one of the big things is just not to focus on just the calories in, calories out,
Hmm.
but just to try to start making those healthy habits of getting some exercise. And those things are all a big ask when you've got a full-time job, very, very busy life,
Hmm.
which, most people do. But those things that will actually make a change, making sure their blood sugar is stable, cutting back on those carbs if your blood sugar is starting to rise, pay attention to their own health, check their lab work. What's going on physically? Are there things that need to be tended to? There's quite a long list of things that they can be doing besides just cutting those calories.
And one of the things that you also mentioned was referrals to integrative or a functional practitioner. What are some of the things that they do that can help with physicians and their weight?
Oftentimes they use a team approach. They will have a nutritionist on board because sadly, many physicians have very little nutritional training. And even though they may have the general idea, to really have a nutritionist on their side to really help them, do a deep dive into what they're eating because, food definitely is medicine. We are what we eat
Hmm.
and what we absorb. So that would be very important. And another big thing is to look at their hormone levels, especially for women. Hormone levels play such a huge role in whether or not you're able to lose weight easily, especially when you get to the perimenopause,
Hmm.
menopause years. That can be such a challenge. And to really have someone that can test those hormone levels and see what needs to happen to replace them and so on, that can be very helpful.
In your article, you talk about how physicians who successfully lost weight changed their clinical approach, shifting from scare tactics to a compassion based approach. What do you mean by a compassion based approach?
Just again, not scolding,
Hmm.
saying, I understand how difficult this is. I've walked in your shoes. What can we do to help? What's standing in the way? To get a real feel for what that patient lives with. Do they even have access to healthy food options? Trying to find out more about, walking in that patient's shoes. What are their barriers to being healthy? And to try to take it from that aspect instead of you need to do this, you need to do that, you need to do this, to actually, step back and try to listen and figure out what's going on, what's the bigger picture.
So, of course, obesity cuts across the entire health spectrum. During your years as a nurse, have you seen these issues also affect the nursing profession as well?
Yes, I mean there was times when I was really quite heavy, and it's difficult to work a 12-hour shift when you have to be carrying along around a lot of extra weight, and then you worry about your back, lifting patients. Nursing can be very strenuous, and it definitely can affect you greatly. You are at the end of your shift, you are just exhausted from not only doing patient care, but carrying your own body weight with you. It's definitely a challenge.
Did you face some of these weight-based implicit biases during your career as a nurse?
I can't say that I really did because when I got really large, then I got busy and did something about it and lost a lot of weight. So, I never let it get to the point where it, prevented me from doing my job, but it sure did add another layer of burden to it. Yeah.
So, can you share some of the techniques that you use on yourself for those others in the health professions who may have been in a similar position?
The biggest thing that I've done in the last decade or so is I have really cut my carbohydrate intake
Hmm.
because there's always that concern of, you don't want to have memory loss as you get older. And I've done a lot of research that, going to a ketogenic type lifestyle, just really getting those carbs out of there. And, I was able to lose almost 70 pounds and keep it off. And that has been, just huge for my life. But yeah, cutting those tasty carbohydrates has made a huge difference in my life.
We're talking to June Pomeroy. She's a registered nurse, and today's Kevin MD article is How Physician Obesity Affects Patient Care. June, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yes, some of the biggest things is I love what one of these physicians, after he had lost weight, that he just really wanted to emphasize metabolic health. And I love he emphasizes building lean muscle mass, optimize your protein intake, stabilize your blood sugar, address sleep quality and regulate stress. And those things all sound like a real win-win to me. And if we can address the weight bias from all angles, then there will be an improvement in obesity care. And improving the physician's well-being by encouraging a healthy lifestyle or with weight loss, that can have a secondary effect of really improving the care then that physician gives to his obese patients. And physicians that have lowered their BMI, they will probably have more confidence in the care that they provide, and they may discuss weight loss earlier with their patients. And probably the most important one would be that the patient's trust and compliance are likely to increase if the physician actually practices what he preaches and is able to maintain a healthy weight himself while he's providing obesity care for his patients.
June, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you.